Today we are going to discuss about health belief models. We all believe in certain things. So even we do talk about the beliefs related to one's health. So what do we actually believe about our own health? So how we maintain it? So today we are going to discuss about few theories which talks about health beliefs. So these health beliefs are basically psychological models that help us understand why people either do or don't engage in health related behaviors. These theories aim to explain why people are more likely to take preventive measures like health actions, as usually we know that getting vaccinated or exercise, while others are not. Few are very much engaged in these health related activities and others not at all indulge into these preventive measures which keeps away from diseases and all. So this models totally talks about these people's belief about health problems and the decisions make based on their belief system, because whatever the decisions, whether we have to do the exercise or not, get vaccinated or not, all these are based on our belief system. Yes, if we are really believing this, exercise or vaccination is helping us or keeping us away from the diseases, definitely people will try to do it. Otherwise they don't consider this as a preventive measure. So today, what makes people believe in these health habits? Yes, today we are going to discuss about various topics which talks about these health models or health beliefs. So if you see the background, how this health belief models were developed, or how it is how people focused on this health beliefs. So the origin of this health belief theories goes back to the 1950s, when public health officials in the United States noticed that people aren't participating in preventive health programs, even when they are available and could clearly save lives. Yes, when people are aware that these health campaigns or screenings are really help them to make them healthy and all, but still people are not utilizing these facilities. So few of these professionals, health professionals, they started working on this. So out of these researchers like Hogbum and Rosenstock and Kegels from the US Public Health Services wanted to know what exactly people are wanted to know what making them away, or what is preventing them not to utilize these services from the government, though they are free of cost. So to understand this, the first model was introduced at this 1950s by these researchers, which is known as health belief model. This is the earliest and most famous health belief model. The basic idea was that people's health behaviors depends on their personal beliefs about their risks, health risks, and the benefits, the actions which they take up. Yes, so if we observe the key health belief theories, so here in this health belief model, this is mostly widely known as HBW or health belief model. It says that people are more likely to engage in health related actions if they believe. What these theories are health belief theories. So what exactly people believe about their health? So these actions are totally dependent on what they are believing in. So according to this health belief model, if people believe in that they are actually at risk for a health issue before they take an action. Yes, means someone who believes they are at high risk for heart diseases, maybe due to family history or something. So this is more likely to change their diet or exercise. Yes, if people are aware about like heart diseases are running in their family, they are more they are more into preventive measures. They do indulge in themselves into exercise or healthy diet or all these things. Then if people think health problem is serious or life threatening, they are more likely to do something about it. Yes. So what we are discussing about, in what situations or how people start believing, what makes them believe that health is important or not important. Yes. So first one is, if they think there is a risk factor in their family, they do take some preventive measures. Or if they think that there is a life threatening issue. Yes. For example, if a person understands how dangerous diabetes can be, they might work harder to manage their blood sugar level. Yes, if they are aware of it, aware of the consequences of life threatening diseases or disorders, they are more likely to follow this health habits. Then people will take action if they believe that the steps that they take, like getting vaccinated or changing their diet, will actually help them reduce the risk of severity of the problem. Yes. So if someone might decided to get a flu vaccine, why people actually wants to take action, vaccination? Even during COVID, there are lakhs or crores of people who have positively accepted and have taken vaccination. So what might be the reason why people are positively accepted and have taken this vaccination? Maybe because they believe it will reduce their chances of getting sickness. If the people believes in a positive way, they do take vaccination. If they think that this vaccination is not going to work out, then definitely they won't take. So it's totally depends on what we are believing. Then our actions are totally dependent on our belief system. And if someone believes that benefits, they won't act unless they feel that barriers, yes, like cost or inconvenience or side effects, or if they think that why should we take this expensive vaccination or surgeries or treatments or something, then definitely they don't follow this health habits, or people, to avoid that, they try to manage this. Then there are certain cues. Yes. So people are often prompted by some kind of cues or reminders. So that will motivate. If you are health practitioner or doctor, someone calls you and says that today you have an appointment. So person will be motivated to take some action, to go for a checkup or for vaccination or surgery or something, or to follow the diet or exercise and all. So some external motivation, some reminders will help a person to strongly believe that health is important for them. So lastly, we can say that this model added self-efficacy also. So self-efficacy is a ability of an individual to complete the task in a given time. Yes. So within the given time, how much a person can complete this. So this self-efficacy in this health belief model addresses the question of confidence. So do people feel capable of actually taking the action? If someone believes they can follow through on the behavior, they are more likely to try. For example, a person more likely to quit smoking. If they feel confident, they can stick to the plan and overcome the cravings. Yes, it's totally depends on the person's belief system. To what extent others will influence or motivate the person. The person himself has some belief system or capability that they themselves can overcome these barriers. They themselves can manage whatever the cravings they have. So definitely the person will follow a right path to take care of their own health. So here, though it talks about so many concepts about person's health and belief system, but still this theory also have certain limitations. So The model does not consider external factors like peer pressure, socioeconomic status, or cultural influences. So these factors do influence a lot a person's behavior. Then it assumes individuals always make logical decisions based on their perceptions, which is not always needed. We cannot calculate always to what extent this medicine is going to work for me, or this vaccination is going to work for me, or this surgery to what extent it is right or wrong. Sometimes based on our unconsciousness or somebody others pressure or motivation, we do take some action. Yes, even this theory or this model lacks the consideration of emotions. Yes, so due to fear, anxiety, or stress, people do take some decisions. So this factor also not addressed by this theory. So these are the few limitations of this health belief model. But still, even with these limitations, we can say that still the theory or this model is widely acceptable and used by many professionals and each one of us. Next, we have theory of planned behavior. So this theory of planned behavior was developed by Isaac Asin in 1980s. So this we can say it's an extension of reasoned action theory that we will discuss later. So this model goes a little deeper into how people make health decisions by focusing on intentions. Earlier theory, health belief model, was totally based on what kind of belief a person is holding and how it is directing the person's actions. But here it is all about intentions, what a person's intention is and how it is directing this health habits or actions. So according to this theory, the stronger a person's intention, then the person is strongly motivated to take up some health activity. Or if the intentions are completely going against, like the person is strongly believing or intentions are nothing is going to happen, then person definitely not going to take up any action for their health. So when we are discussing about these intentions, these intentions are based or influenced by three main factors. So these factors are attitudes towards the behavior, which means how positively or negatively a person feels about the behavior. For example, if someone has a positive attitude toward exercising because they believe it will help them feel stronger and healthier, they are more likely to stick to a workout plan. Yes, if they don't have any intention to maintain a good posture or healthier or stronger body, then definitely they don't follow that routine. So attitude is one of the important factor which influence the intentions of an individual. Then we can say a subjective norm. So a subjective norm is a social pressure people feel from those around us or around you. So if people gives an importance to an individual or family members, friends or society, they do follow. Yes. So for example, if your family encourages you to eat healthier, yes, so you might be more likely to adapt better eating habits because you feel pressure to fit in with their expectations. Yes, because our family is important for us. Or if your friends are very much health conscious, they are maintaining diet and all, we do follow them because we want to be with them. We want to be with family, friends or the society. So due to that pressure, because we want to be the part of a group, we do follow them. So the second influencing factor for this intention is social norm. Then the third important controlling factor or influencing factor, we can say it is perceived behavioral control. Yes. So this perceived behavioral control is very much similar to self-efficacy. So in health belief model, we already discussed about how this health self-efficacy is influencing a person's belief system. Here we are saying that the same self-efficacy is influencing a person's intentions. Yes. So how it is influencing? So, if someone who feels they have access to a gym, yes, and they have enough free time, so they might feel to control their ability to exercise regularly. Means I have the resources, I can utilize it. If the people doesn't have any resources, this kind of gym facility or any other, they cannot find any leisure time to go for a walk or do some exercise and all, so they cannot do it. So, self-efficacy talks about a person's ability. Yes. So, what a person is feels and what a person can do within the given situation. Then even this theory also has certain limitations. Yes. So, here the limitations like health belief model, it assumes rational decision making and doesn't account for emotional aspects of behavior. Here even this theory also focuses mostly on a person calculate everything. Yes, all these factors whatever we discussed, it's like intentionally a person decides what they have to do, what they are not supposed to, and based on that they will take action. But in practical, in our day-to-day life, it is not possible. We cannot always sit and calculate what is right, what is wrong. Yes. So, this is one of the limitation of this theory, and this theory also did not focus much on emotional aspects. Next, the next theory is about, it may not fully explain habitual or automatic behaviors that don't involve conscious intentions. Yes, certain things we do, but we have no clue or idea why we are doing it actually. Yes, so it maybe at your early age your parents might have taught you like you need to have a good sleep or good diet or exercise, then without having that knowledge you might be simply following it. So, these aspects also not fully focused in this theory. So, even though with these limitations, intentions plays an important role in a person's life to take up health related actions. Then the next theory, it talks about the protection motivation theory, which is known as PMT, protection motivation theory. So, this was created in 1975 by R.W. Rogers to explain how people respond to threats. First theory is about belief system, second theory is about intention, and the third theory is about threat. Yes, what is the threat for our life? So, in COVID, why people have taken so many health measures? Because they felt that threat. It's a life dangerous disease or a viral infection. So, they want to take certain measures to overcome that. So, this theory, this protection motivation theory is fully focuses on the threat. How a person responds to these threats, especially the health risks. Whenever they experience some health risk is there, so how a person respond to it behaviorally. So, the basic idea is that when we feel threatened, we make decisions based on two things: how serious we think about the threat and whether we believe we can do something about it. Yes. So, originally this protection motivation theory was used to understand health related behaviors like quitting smoking or taking preventive measures against diseases. But now in the present scenario, this is used in other areas too, like encouraging people to take actions on climate change or protect themselves from cyber threats. Yes, nowadays there are so many cyber cases are filing. So, how a person can protect themselves. So, when there is a threat, always we think about some protection. Yes. So, what measures we are taking to protect ourselves against this threat or risk, whatever we are seeing or observing around us. Then this theory works on focusing on two key processes, that is threat appraisal, which means how dangerous we think the threat is, and coping appraisal. One is threat appraisal, another one is coping appraisal. Coping appraisal talks about whether we think we can handle it. Yes. So, how danger it is and to what extent I can cope with this. So, these are the two important processes which we always consciously or unconsciously follows. Then this coping appraisal, whether we think we can handle it or not, together these help these two, threat appraisal and coping appraisal, helps an individual to explain why people chose to take action or not. Yes. So, based on a person's coping appraisal as well as threat appraisal, we can come to an understanding whether this person able to take any measure against to this disease or not. Yes. So, person always whenever a person has some health disease, for example like diabetes, okay, how much it is dangerous for an individual's health. First a person thinks about it, then what are the resources a person has, maybe a medical facility or diet or what are the other measures a person can take, what is in their hand. So, based on these two, yes, they will do some mathematical calculations and come to a conclusion or a solution, we can say that whether I have to go for a medical checkup or not. Yes. So, if we observe the key components of this protection motivation theory, here first we can say we have to talk about threat appraisal. So, it is nothing but how we see the danger. So, this perception can take place in two ways. In two ways we can perceive the danger. One is perceived severity. Yes, another one is perceived vulnerability. So, this perceived severity is how serious we think the threat is. For example, a smoker might know that smoking causes cancer, but may not feel the risk is severe. Yes, I am into the smoking, so that might lead to cancer, but that is not that much serious for me. Yes, so that is their perceived severity. Then vulnerability, perceived vulnerability talks about whether we feel personally at risk. Yes, in general people whoever smokes they might get cancer, but whether I get it or not, that talks about perceived vulnerability. So, here a smoker might think I know smoking is bad, but it won't affect me. If they believe or perceive in this manner, they definitely are not going to quit smoking. Yes. Next, coping appraisal. So, first one is about how a person is perceiving the risk or severity of that risk. Second one is how the person is dealing with that risk, that is nothing but coping. So, this coping appraisal is how we view our ability to handle the threat. Yes, every individual will have certain ability. So, how they can overcome this or how they can deal with it. So, here this also can be explained by two parts. The coping also can be explained by two parts. One is response efficacy. It is the believing that taking action will work. If I start taking up some action, definitely it is going to work. For example, the same smoker example we will take here. If the smoker believe quitting will lower their risk of cancer, yes, instead of I am not going to get it, if a person says in a coping aspects, if a person says if I reduce my smoking on a daily basis, definitely it is going to lower my risk of cancer. So, definitely they are more likely to stop it. Then self-efficacy again. So, this concept of self-efficacy you can find in each and every theory. So, it is one of the self-efficacy is a skill, it is an ability of an individual. So, here how these people used in this model. So, self-efficacy in this model is about confidence, how much a person has the confidence to overcome that problem, whatever the risk or threat they are experiencing. So, how much confidence a person has. So, the same example we continue. So, the smoker must feel capable of quitting. So, the person might be thinking that I am capable enough, I am not completely addicted towards the smoking. If a person start believing that, have the confidence on themselves, then it is easier for them to take up actions against against to this risk factor. Yes. So, finally, we can discuss in this model about fear arousal. So, the role of fear in most of the times whenever a person is in fear or in threat, that will motivate a person to take up some action. So, overall, protection motivation theory talks about a threat is an important component which is motivating an individual to take up some action about their health habits or going against to risk habits. Then even this theory also has certain limitations. So, this theory relies a lot on fear appeals, because the major component of this theory is fear and threat. So, it is completely relied on fear appeals. So, always the actions whatever we are taking about our health might not be based or rely on fears. So, that is not completely explained by this theory. Then it overlooks emotions and social factors. Even this theory also not considering the emotions. A person might be having or giving so much of importance to their family, their children or spouse or elders, parents and all. So, which is motivating, might be motivating a person to take up health related actions. So, these concepts, these emotional attachments are not involved in this theory. This is not focused. It's also considered as a limitation. Then it assumes people have control over their actions. Sometimes we don't have control over our actions. Yes. So, certain barriers like cost or access to health care or some other limitations makes it hard to take up action. People might be thinking to take some preventive measures or wants to go for a regular checkup and all, but mostly we are seeing that health industry is too expensive and time consuming. So, due to these barriers, people might not be showing interest to take up this health actions. So, which is not included, this aspect is not explained or included in this model. Finally, the decision making process. Yes, totally decision making is based on the threat, based on coping, based on the risk factors. Yes. So, here it is very simple and step by step thing. Yes, it is not covering the reality. We always cannot say that how the person is perceiving the threat and what coping mechanisms the person has or resources he has, and based on that he is taking a decision. It's not that simple. So, reality, what a person is actually facing and how he is taking a decision is far difficult or far complex compared to what these models or theories are explaining. So, health belief model is finally totally based on the belief system of an individual. Then this theory talks about the threat, and the one more theory talks about the intentions. So, not only the belief system, intentions or risk behaviors influencing a person, but emotional factors also do contribute.